Hello and welcome to this video on the difference between psychologists and psychiatrists. Both psychologists and psychiatrists are healthcare professionals who work with individuals to improve their mental health, but their roles and approaches to treatment can vary significantly. Psychologists are professionals who have completed a university degree or a doctoral degree in psychology. The level of qualification needed to practice depends on the jurisdiction of the area or the country of their practice. Psychologists are licensed to practice therapy and conduct psychological assessments. They work in a variety of settings including private practices, schools, hospitals, and government agencies. Psychologists use various techniques such as talk therapy, behavioral interventions, and cognitive restructuring to help individuals cope with mental health issues. They also conduct psychological assessments to diagnose mental health disorders and evaluate a person's cognitive, emotional, and behavioral functioning. Psychologists typically work with individuals who are experiencing mild to moderate mental health issues such as anxiety and depression, and they can help individuals learn coping skills to manage their symptoms. They may also work with individuals who are experiencing more severe mental health issues such as bipolar disorder or schizophrenia. But in such cases, they often work in conjunction with a psychiatrist to provide a comprehensive treatment plan. Psychiatrists are medical doctors who specialize in mental health. They have completed medical school and a residency in psychiatry and are licensed to prescribe medications and provide therapy to individuals with mental health issues. Psychiatrists typically work in hospitals, clinics, or private practices. Unlike psychologists, psychiatrists can prescribe medication to treat mental health disorders, such as antidepressants, antipsychotics, and mood stabilizers. They also provide therapy, but their approach tends to be more focused on medication management than talk therapy. Psychiatrists typically work with individuals who have more severe mental health issues, such as bipolar disorder, schizophrenia, and severe depression. They also work with individuals who have comorbid medical conditions that impact their mental health, such as epilepsy or Parkinson's disease. Differences and similarities. One of the main differences between psychologists and psychiatrists is their educational background. Psychologists usually have a doctoral degree in psychology, while psychiatrists have a medical degree with a specialization in psychiatry. Another difference is that psychiatrists can prescribe medication while psychologists cannot. Despite these differences, psychologists and psychiatrists share many similarities. They both work with individuals who are experiencing mental health issues, and they both use various techniques to help individuals manage their symptoms. They also collaborate with other healthcare professionals such as social workers and primary care physicians to provide comprehensive care to their patients. Choosing the right professional. Choosing the right mental health professional can be a daunting task, but it's essential to find someone who is a good fit for you. Here are some factors to consider when choosing between a psychologist and psychiatrist. Severity of symptoms. If you're experiencing severe mental health issues such as hallucinations, delusions, or suicidal thoughts, a psychiatrist may be the better choice, as they can prescribe medication to manage your symptoms. However, if you're experiencing mild to moderate symptoms, a psychologist may be a good fit. Treatment preferences. If you prefer to manage your symptoms without medication, a psychologist may be the better choice. However, if you prefer medication to manage your symptoms, a psychiatrist may be a good fit. Insurance coverage. Insurance coverage can vary for mental health services, and it's essential to check your plan's coverage before choosing a professional. Some plans may cover only one type of provider, while others may cover both. Personal preferences. It's essential to find a mental health professional with whom you feel comfortable and can build a rapport. Factors such as age, gender, and cultural background may influence your choice. Collaboration between psychologists and psychiatrists. Collaboration between psychologists and psychiatrists can be beneficial for individuals with complex mental health issues. Working together, they can provide a comprehensive treatment plan that includes both medication management and talk therapy. Collaboration can also be helpful in cases where individuals are not responding well to medication alone and may benefit from talk therapy to address underlying issues. Collaboration between mental health professionals can occur in various ways. For example, a psychologist and psychiatrist may work together in the same clinic or hospital and share patient information to provide coordinated care. Alternatively, they may work independently but communicate with each other to ensure that treatment is consistent and complementary. It's important to note that collaboration between mental health professionals requires consent from the individual receiving treatment. Individuals have the right to choose who provides their mental health care and can choose to work with only one professional if they wish. Training and licensing. Both psychologists and psychiatrists undergo extensive training and education to become licensed professionals. Psychologists typically earn a doctoral degree in psychology, which includes coursework in areas such as cognitive psychology, developmental psychology, and social psychology. After completing their degree, they must pass a licensure exam to become licensed to practice in their state. Psychiatrists, on the other hand, complete medical school and a residency in psychiatry. This training includes coursework in general medicine, psychiatry, and neuroscience. After completing their training, they usually must pass a licensure exam to become licensed to practice in their state. It's essential to note that licensing requirements can vary by state or country, and it's important to check the licensing requirements in your state or country before choosing a mental health professional. Insurance coverage. Mental health services can be costly, and it's essential to consider insurance coverage when choosing a mental health professional. Many insurance plans cover mental health services, but coverage can vary depending on the plan and provider. Some plans may require a referral from a primary care physician, while others may allow individuals to self-refer. It's essential to check your insurance plan's coverage for mental health services before choosing a mental health professional. If you have a specific preference for a provider such as a psychologist or psychiatrist, you should check to see if they are in network with your insurance plan. If they are not in network, you may be responsible for paying a higher percentage of the cost. It's also important to note that some mental health professionals may offer sliding scale fees or reduced rates for individuals who do not have insurance or have limited coverage. Stigma. Despite significant progress in recent years, mental health still carries a stigma in many communities. Some individuals may be hesitant to seek treatment for fear of being labeled or discriminated against. This stigma can be especially prevalent when seeking treatment from a psychiatrist, as they are often associated with medication management. It's essential to remember that seeking treatment for mental health issues is a sign of strength, and it's essential to prioritize your mental health and well-being. Mental health professionals are trained to provide compassionate and non-judgmental support to individuals experiencing mental health issues. It's also important to recognize that mental health issues can affect anyone, regardless of their age, gender, race, or socioeconomic status. Seeking treatment can be an important step towards improving mental health outcomes and reducing the stigma associated with mental health. Ethics. Both psychologists and psychiatrists are bound by ethical principles that govern their practice. The American Psychological Association and the American Psychiatric Association have established codes of ethics that guide the conduct of psychologists and psychiatrists respectively. These codes of ethics cover areas such as confidentiality, informed consent, and boundaries. For example, mental health professionals are required to maintain strict confidentiality with their parents, except in cases where there is a risk of harm to themselves or others. They are also required to obtain informed consent from their parents before providing treatment, and to maintain appropriate boundaries to avoid dual relationships. It's essential to choose a mental health professional who adheres to ethical principles and standards. If you feel that your rights have been violated, you can file a complaint with the state or local licensing board or professional association. Continuing education. Both psychologists and psychiatrists are required to complete continuing education to maintain their licenses and stay up to date with the latest research and best practices in their fields. Continuing education requirements can vary by state and profession, but generally require a certain number of hours of training each year or every few years. Continuing education can help mental health professionals stay current with the latest treatments and techniques and provide better care to their patients. It can also help mental health professionals improve their skills and knowledge in specific areas such as trauma or addiction. It's essential to choose a mental health professional who is committed to continuing education and staying up to date with the latest research and best practices in their field. Telehealth. Telehealth has become an increasingly popular option for mental health services in recent years, especially during the recent pandemic. Telehealth involves using technology such as video conferencing to provide mental health services remotely. Both psychologists and psychiatrists can provide telehealth services, and it can be a convenient option for individuals who have limited access to in-person services or who prefer to receive services from the comfort of their own home. Telehealth can also be a cost-effective option, as it eliminates the need for travel and can reduce the cost of mental health services. It's important to note that not all mental health professionals offer telehealth services, and the insurance coverage for telehealth services can vary. It's essential to check with your insurance provider and mental health professional to see if telehealth services are covered and available. Cultural competence. Cultural competence is the ability to understand and respect the cultural beliefs, values, and practices of individuals from diverse backgrounds. It's important for mental health professionals to have cultural competence to provide effective and appropriate care to individuals from diverse backgrounds. Both psychologists and psychiatrists are trained to provide culturally competent care, but it's essential to find a mental health professional who has experience working with individuals from diverse backgrounds. It's also important to find a mental health professional who is willing to learn and adapt their approach to meet the unique needs and preferences of each individual. Conclusion. In conclusion, psychologists and psychiatrists play vital roles in the mental health field and can help individuals manage their mental health issues and improve their quality of life. While their roles and approaches to treatment can differ, both professionals are committed to developing individuals achieve better mental health outcomes. When choosing a mental health professional, it's important to consider individual needs, preferences, and circumstances. It's also important to find a mental health professional who can provide personalized and effective treatment, who adheres to ethical principles and standards, and who has a culture of competence. Seeking treatment for mental health issues can be an important step towards improving mental health outcomes and reducing the stigma associated with mental health. It's essential to prioritize mental health and well-being, and to find the support and resources needed to achieve better mental health outcomes. If you're interested in discovering more about mental health and well-being, then be sure to check out this video at the first link in the description. Subscribe and turn on notifications so you don't miss more videos helping you with mental health, well-being, and more. Check out this playlist of my top 10 videos, and I'll see you in the next video. Take care.